much, and thank you for holding this hearing, and I thank the panel for their testimony. Along with many Floridians, I'm concerned about the alarming increase in prescription drug abuse and illegal sales of prescription medications. I believe that issues concerning both overprescribing and the illegal use and sale of these drugs should be addressed. Prescription drug abuse is both a federal and state issue, and I've worked with both local and federal officials to take on this issue. In my district, Pasco and Pinellas counties have had some of the highest oxycodone cause of death, with 197. Hillsborough County, this is the Tampa Bay area, was fourth in Florida with 128 deaths from oxycodone. Sadly, Pasco and Pinellas counties also led the state in methadone deaths and hydrocodone deaths. The number of ER-related visits from misuse or abuse of prescription drugs has nearly doubled in the past 5 years. Recently, there was a drug summit in Pasco County where both health officials discussed the growing problem of babies born addicted to prescription drugs. Pinellas County ranks first in the state for babies born addicted. Florida has taken some positive steps to fight prescription drug abuse, such as legislation to eliminate pill mills in 2011. Florida currently runs 4 drug tracking programs in addition to the controlled substance reporting system. The number of doctors on the DEA's list of top 100 purchasers of oxycodone declined by 97% in a single year, and pain management clinic registration decreased by 36%. This is a good start, but there's much more work to be done. I'm sure you'll agree. That's why I've instructed my office to look into issues of prescription drug abuse and developing, of course, future legislation. And again, Mr. Chairman, I really appreciate you holding this hearing. I have a couple questions. Mr. Kerlikowske, I talked a bit about this, of course, the growing problem of babies born addicted to prescription drugs such as the oxycodone. This is a serious problem in our communities. I'd like to have you come down, if you will, to the Tampa Bay area and meet some of the local officials, the health officials and providers who are dealing with this growing problem. I want to ask you a question. Are there any funds or programs available for the local community to tap into to help with the problem, either on the prevention or treatment side? And of course, and I also want to ask Dr. Clark, are there resources for my community, of course, from SANSA? So those are the questions.
Congressman, we fund the Drug-Free Communities program, these grassroots communities programs that do prevention. And of course, oftentimes that local voice is more powerful and more important to people about prevention. And we have worked with them to help them understand and become more knowledgeable. We fund almost 700 of them around the country to become more knowledgeable about this neonatal abstinence syndrome. Because we're seeing in a number of states, Florida, who is, and I attended the first meeting of the advisory committee that has worked so hard under the Attorney General to reduce that problem. It's a complex problem because there are women in pain that are also pregnant and are being treated. There are women in drug programs at the same time, and so there has to be a very careful balance. But I would also tell you I would be happy to visit the Tampa Bay area with you and examine this more closely.
Well, thank you very much. I appreciate that. I welcome that. Anyone else wish to comment on the panel?
We have targeted capacity expansion grants that are available to the states. The states can use their block grants to help promote education. We are developing an internal strategy to deal with NAS. We recognize that it's much broader than the prescription opioids. It involves heroin, but as you know, that anytime a woman has to take medication while she is pregnant, there is some associated risk for the neonate, and so what we're trying to do is promote adequate education of consumers and practitioners so that we can address these issues. We have a pregnant and postpartum women's program that allows women who have addiction problems to get into treatment during the time that they are pregnant, and when they deliver, we can deal with both the mom and the child, and the data do show that the outcomes of the birth are much more positive when we have those kinds of programs. But the most important thing is having this concerted effort involving multiple layers at the state level, at the local level, community level, involving practitioners as well as consumers.
Thank you. Thank you very much. I yield back, Mr. Chairman.
Chair, thanks, gentlemen. The House is